So today I am going to take one class that is regarding the case study. The topic of the case study is the hypertension and heart failure. So in the first case we will discuss about the hypertensions, and in second case we will discuss about the heart failure. So at the very beginning, before going to the case, we must know about the basic definition of hypertensions. So hypertension is nothing. It is the persistent increase of blood pressures on the wall of blood vessel. So the persistent increase of pressures into the wall leads to several physiological changes into the physiological system. So here we will try to explain about the possible causes, the factors and the mechanisms, how all these things are related to the developments of this particular pathological conditions called hypertension. So now let me start with the case. So what is the case here? In this case, a 55 years old male visits his family physicians for routine health checkup. He reports no specific complaints as such and feels generally well, but mentions some occasional mild headaches, which he attributes to the stress at work. So at the very first lines, it is mentions the person feels occasional mild headache, and these mild headaches are the attributes to stress at the workplace. His blood pressure is measured twice. Now, so between the measurements of the blood pressures, there is a gap. This is around 2 minutes, right? So after 5 minutes of rest, he measures the average reading of blood pressures. So here, what is the average reading of blood pressures? It is around 152, that is systolic blood pressures, and 94 millimeter mercury, that is diastolic blood pressures. At the same time, different vital parameters also examined along with the systemic examinations. Now, all these examinations are within the normal limits, right? Now, his previous blood pressures taken about 2 months back, that was around 144 by 94 millimeter mercury, right? At the same time, he measures his BMI value, that is around 28 kg per meter square, and he generally admits to a sedentary lifestyle, right? Now, his family history tells there is a history of cardiovascular morbidity in his fathers, right? So in this particular case, there are lots of informations, right? Based on these informations given, we have to diagnose the patients first, and after that we have to explain what are the possible causes for the developments of this disease and what is the mechanisms of the development of this disease, right? Now we will explain one by one. Now first see, according to the information given, what is the possible diagnosis? And if your possible diagnosis is correct, you have to justify this, right? As I mentioned in the case, the person suffers with mild headache. It is attributes to stress, and the average blood pressure value is around 152 by 94 millimeter mercury, and his vital parameters and systemic examinations is normal. The blood pressure that is recorded 2 months back is also high. His BMI value is not normal, and he basically leads sedentary lifestyle. So all these factors indicate something, right? All these factors are responsible for the changes in the blood pressure value, right? and this blood pressure value persists for a longer period of time. If the blood pressure values persist for a longer period of times, there is a high chances of the development of a disease called hypertension. So based on these information given, now we can say the subjects may have the hypertension, right? Either the stage 1 or stage 2. Now we have to justify this, right? So what are the justifications against the diagnosis? See, there are some standard value for all those parameters, so-called reference value. Based on this reference value, if we compare the reference value with the value that is given here in the case, we easily can diagnose the subject, right? Now you can see here regarding the blood pressure value, this is 152/94. Previous blood pressure value, that is 144 and 94 millimeter mercury. Now, as I mentioned, there is some reference value or standard value. We have to compare our value with the reference value so that we can diagnose the subjects, right? You can see normal blood pressure value is around 120 or less than 120/80 millimeter mercury. That is systolic is 120 millimeter mercury and diastolic is 80 millimeter mercury. There is a slight elevations. The second case, that is the systolic value is in a range, that is around 122, 129, and diastolic value is less than 80 millimeter mercury. Here it is elevated blood pressures. But if you see the stage 1 hypertension, according to the reference standard that is given by AHA, it is around 130 to 139, that is systolic one, and 80 to 89, that is the diastolic one. Now, in our case, it was recorded 152/94, right? These are some references. And in case of stage 2, you can see it is greater than 140 for systolic and 94 or 90 or above 90 for diastolic. So based on this reference chart, we can compare our subject, right? Now, it means this consistently shows that readings in the stage 2 hypertension range, right? And even if we compare this reference with the previous reading, these also comes under this range, right? It means subjects may have stage 2 hypertension. Now we have to check what are the other factors that may be related with the hypertension development. Yes, some risk factors are present, and those risk factors are, some are modifiable risk factors, some are non-modifiable risk factors. So here you can see some risk factors, that is the age of subjects, family history, status of nutrition and lifestyle. As I have already mentioned, subject's age is 55 years. So according to the record, there is a high chances of the development of the hypertension with the increase of subject age. So here the age is little high, so there is a high chances of the development of this disease. And if you see the family history, in the case there is a positive for cardiovascular disease. Here we have seen the family history, cardiovascular morbidity in his father, right? So it means this is again another important factor for the development of this disease, right? Now we have mentioned about the BMI value of the subjects, that is around 28, right? So here 28 kg per square meter, and it indicates subjects is under in a category that is overweight status, which is another important factors influencing blood pressures, leads to developments of hypertension. Now another important factors, that is the lifestyle. So subjects leads the sedentary lifestyles, another important factors that facilitates the developments of hypertension. So now we can say these are some justifications based on which we can say yes, subjects are having some physiological, pathological complications having the hypertensions. Now, question is, what are the most important risk factors that is related with the development of this particular disease, right? As I have already mentioned, there are numbers of risk factors. Now, question is, how these risk factors helps in the development of this disease, right? Now, you can see age is an important influencing factors of blood pressures. So, how it influences the blood pressures? You can see with the increase of age, there are the changes in the arterial conditions, right? Arterial stiffness occurs, right? At the same time, there is a reduced vascular elasticity. Here, the changes in the stiffness and changes in the elasticity of the blood vessels, both are equally important in the development of high blood pressures and ultimately the development of hypertension, right? See, family history, important influencing factors. So, there is a history of CBD. So, here the most important things, if there is a genetic predispositions, there is a high chance of the development of this particular disease, right? Now, see the BMI value, subjects is under overweight category. So, this overweight category is also an influencing factors. How it influences? See, it causes increase in the strains of the heart as well as vascular system. So, increase in strain in the heart and vascular systems, both equally facilitates high blood pressures as well as hypertension. You can see not only these changes, at the same time the body weight also involves with the some metabolic changes. So, what is the metabolic changes occurs here with the changes of body weight? There are the changes in the insulin activity, right? So, insulin resistance is also may happen. So, here due to the high BMI, insulin molecules unable to absorb sufficient amount of sugars, that leads to the changes in some that leads to the development of some comorbidities like diabetes, and diabetes is an comorbidities which facilitates the development of hypertension, right? See, not only the changes in the insulin activities, it also equally involves with the sympathetic nervous system activity. Here, increase in sympathetic nervous system activity. So, both of this leads to the changes in the blood pressure, blood pressure value, right? Now, how the sedentary lifestyles affects the blood pressures and how it facilitates the development of hypertension. It reduces the heart efficiency. Obviously, with the decrease of heart efficiency, there will be less cardiac output, right? It contributes weight gain. This weight gain ultimately worsens the hypertension. Along with these factors, some stress, if it is chronic stress, this chronic stress also leads to long-term activations of sympathetic nervous systems, and these long-term activations of sympathetic nervous systems ultimately leads to increase in heart rate as well as the vascular resistance. If there is a high resistance in the blood vessels, obviously there will be high pressures and lead to developments of hypertension. So, this is how this different type of factors helps to facilitate the developments of hypertension. Now, what are the most important causes of the disease? So, as I mentioned, there are some factors which are modifiable factors. There are some factors which are non-modifiable factors, right? Both the modifiable and non-modifiable factors are equally important for the development of disease. Now, other than these things, some secondary conditions are also equally important for the development of this disease. What are the secondary conditions or factors, and what are the primary factors? The primary factors are those which is basically involved with the developments of essential hypertension. So, genetic predispositions, aging, obesity, sedentary lifestyles, high salt intake and chronic stress. As in the case, it is mentions the presence of all these factors. It means since all these factors are present in the case, the persons are having high chance of development of hypertension. Not only this, if you see the causes of the development of this disease, so some comorbidities are also equally important. Like if there is a kidney disease, like reduced kidney's ability to regulate blood pressures. Obviously, due to the renal dysfunctions, there is a loss of regulations of blood pressures, right? As well as there are certain types of hormone, so-called endocrine hormones. Secretions of hypersecretions of those endocrine hormones leads to the developments of some endocrine disorders, and these endocrine disorders leads to excessive hormone productions, and these hormone productions or excessive hormone productions helps in the increase of blood pressures, right? Now, sleep apnea. Yes, it is again another important cause for the disease. So, how it is important? Frequent drops in oxygen level during a particular stage, like during sleep, increase blood pressures. So, how? Through sympathetic overactivations. It means the overactivations of sympathetic nerve ultimately facilitates the development of the hypertension, right? Now, there are some medications that show some negative impact. So, what are those medications? Yes, certain drugs, certain non-steroidal anti-inflammatory drug, oral contraceptives, some steroid drugs, some antidepressants. They all are equally important for the developments of this disease, right? Now, at the same time, the consumptions of excessive alcohol along with some stimulants is equally important. So-called, we could say, the positive agent for the developments of the hypertension, right? Now, the third questions that is asked here, what are the physiological derangements, right, in the cardiovascular regulatory mechanisms? Yes, as I mentioned, there are lots of factors that alters the normal flow of blood through the blood vessels, that alters the diameters of the blood vessels. Now, question is, what is the exact mechanisms or what is the exact physiological mechanism that is related with the developments of the hypertensions? See, in hypertensions, the cardiovascular regulatory mechanisms are significantly deranged. Yes, and due to this deranged, it leads to persistent high blood pressures. So, what is the physiological mechanisms that is related with this? The first is increased vascular resistance, and it is due to chronic vasoconstriction, right? It is due to arterial stiffening, and it is also due to the dysfunction of endothelial system. So, dysfunction of endothelial systems leads to reduced nitric oxide productions. As we know, the nitric oxide is a vasodilator, right? But here, due to the dysfunctions of endothelial systems, there is a reduced amount of nitric oxide. Obviously, reduced amount of nitric oxide facilitates the chronic vasoconstriction, and chronic vasoconstriction leads to the vascular resistance, and vascular resistance ultimately facilitates the hypertension developments, right? Now, second case, you see, the autonomic nerve systems becomes overactive, right? So, due to the overactivity of autonomic nervous systems, there is an increased sympathetic tone, reduced baroreceptor sensitivity, and both the increased sympathetic tone and the reduced baroreceptor sensitivity ultimately causes the changes in the heart rate. There is an increase in the heart rate, right? So, increase in the heart rate actually because it needs more forces for the proper blood flow through the blood vessel, right? So, here there is a changes in the heart rate as well as vascular tone. Now, other than these two physiological conditions, there is another important factors that is also equally important for the disease developments. So, what is this? This is actually renin, angiotensin, aldosterone system. So, how this system is involved with the developments of this disease? See, the renin angiotensin system is often overactivated, right, resulting in excessive angiotensin 2 formations along with the excessive aldosterone hormone productions, right. So here both the angiotensin 2 or excessive angiotensin 2 and excessive productions of aldosterone both are equally involved with the vasoconstriction, which is the most important factor for the disease development. Not only this, both the angiotensin 2 and aldosterone is involved with the sodium retentions as well as the remodeling of vascular system. So here three things. One is the vasoconstriction, sodium retentions and the vascular remodelings. All these three things are influenced by this renin, angiotensin, aldosterone system. This is the physiological mechanism that is related with the developments of hypertension. Here, the subjects who are suffering with this particular disease, in their case, there is a alterations in this renin, angiotensin, aldosterone system, right? Now, the next important thing, as I mentioned, renal dysfunction, right? So, kidney dysfunctions further impair sodium excretions. As we know, there is it needs the optimum balance of sodium in extracellular fluid. But here, in this particular case, there is a high chances of impairment of sodium excretions, right? So these impairments of sodium excretions allows the developments of, changes the blood and the changes in the blood volume ultimately lead to the developments of disease. Along with this, you can see these changes coupled with the insulin resistance and left ventricular hypertrophy from chronic pressure overload. Yes, here pressure overload contributes to the sustained elevations of blood pressures and increased cardiovascular risk. So mainly three different mechanisms are altered here, right? One is the changes in the blood vascular system, another one is overactivity of the sympathetic systems, another is renin, angiotensin, aldosterone systems, and dysfunctions of kidney systems, right? All these things are equally important for the developments of this disease. So the subjects who are having the hypertension, in their case there is a derangement of this physiological system, right? Now a question is, what is the physiological basis of the treatment of the hypertension? Right? Yes, there are some possible physiological strategies of treatments. So what are the possible treatment strategies? Like angiotensin converting enzyme inhibitors as well as calcium channel blockers. Both are used as a purpose of treatment. So what is the mode of actions of ACE and what is the mode of actions of the calcium channel blockers? You can see these angiotensin converting enzymes, mainly this particular drug, it inhibits the angiotensin synthesis, right? So that reduces the formations of angiotensin 2 levels. As we have seen in the previous case, there is a high level of angiotensin 2 synthesis, right? Excessive angiotensin 2. But here these inhibitors inhibit the synthesis of angiotensin 2, causing vasodilatations as well as reduced aldosterone release, and this reduced aldosterone release leads to lowering blood pressure, blood volumes and blood pressure's value. So these mechanisms of treatments is very effective to reduce the blood pressures, to improve the subjects, right? Now the calcium channel blockers. So yes, these blockers is also equally important. The altered calcium channels acts in the vascular smooth muscles, because in the membranes of the vascular smooth muscle, there are some receptors for this calcium channels. So use of these calcium channel blockers reduces the vasoconstrictions. Yes, as we have seen, due to the reduced synthesis of nitric oxides, there is a vasoconstrictions. But if you use these calcium channel blockers, it reduces the vasoconstrictions as well as it reduces the peripheral resistance. Both the reductions of vasoconstrictions and peripheral resistance are helpful to improve, to maintain the normal blood pressures into the subject, right? So these are the some important fact that is related to this first case. So in this particular case, let me brief again. In this first particular case, it is given all the necessary informations. Based on the necessary informations, the persons are diagnosed with the stage 1 hypertension, right? And after the diagnosis, we have justified about the possible diagnosis, right? And after that, we have discussed about the possible factors involved and how these factors are involved in the development of this particular disease. And after that, we have discussed about the physiological derangements into the subjects who are having hypertension, and we also have discussed about the possible treatment strategies and their mode of actions. I hope now the case is clear to you. Now the second one. The second case is related with the heart failure, right? So before I proceed to the case, let me define first what is heart failure. Yes, heart failure, which is also called a congestive heart failure, and it is a complex clinical syndrome. It is not a single disease. That is why the terms mentioned here, it is a syndrome, right? Which results from any structural and functional impairments of the ventricular filling or ejections of the blood. Two things involved here. One is there is an impairment of ventricular filling or ejection of blood from ventricle, right? Both the things are involved with the development of this syndrome. Now we will discuss these particular conditions using some case. Now what is the case here? This is the case that is related to the heart failure. Let me read the case. A 68 years old female presents to the emergency department complaining of increasing shortness of breath, exaggerated when lying flat during night, right? He reports having on and off breathlessness for the past 2 months. Recently, she had been experiencing such symptoms even with a minimal exertion, right? Her past medical history includes hypertension for past 10 years and myocardial infarctions for 2 years ago, right? If we see the general physical examinations, it reveals edema in her ankles. Heart rate is around 110 beats per minute. Blood pressure is 100 by 68 millimeter mercury. Respiratory rate 28 breaths per minute. And temperature is also given. And now, if you see the systemic examination, it shows fractures in both the lungs and distended jugular veins and hepatomegaly. Lots of informations are given. Now we have to diagnose based on the information given in this particular case. See, the persons complaining of increasing shortness of breath. I repeat the case. Person complaining of increasing shortness of breath, exaggerated when lying flat at a particular time, means during night. Now, she also reports on and off breathlessness, and these conditions are observed for the past 2 months. Now, what is the recent happening? She had been experiencing such symptoms even with minimal exertions. This is the recent observations. Now, if you see the other medical history, hypertension was observed. And these hypertensions observed for a long period of time, for the past 10 years. At the same time, there are some parameters that was also recorded, that are vital parameters. Now let us diagnose the subjects, and according to the diagnosis, let us justify. Right? The terms that are highlighted here, the most of the things or most of the factors are related to the development of this particular syndrome, heart failure. That is why I am highlighted the most important points. Alright? Now we will explain how these factors are involved in the diagnosis, how these factors helps in the diagnosis of the subject. If you see the patterns of the diagnosis, or if you see the types of heart failures based on the conditions given here, there is a high chances of the development of left ventricular heart failure, right? And there is some involvement of right side. Now, what is the possible justification? See, the first one, there are some classical symptoms that are related with the developments of heart failure. So what are those classical symptoms based on which we can diagnose the subject? Yes, these are classical symptoms: dyspnea or exertion, then breathlessness, then a volume overload. Along with this, some physical findings also correlate with the diagnosis. Now see, here in the case, it is mentions increasing shortness of breath. So in the classical symptoms I mentioned dyspnea or exertions, it is nothing, it is the progressive shortness of breath over 2 months, even at rest. And this symptoms is a hallmark of heart failure, right? So which is given in the case, right? Now comes to the second point, breathlessness on lying flat. This is also given in the case. So now see, it indicates the pulmonary congestion. Yes. So due to the pulmonary congestions, or pulmonary congestions are mainly due to increased venous return, right? So not only increased venous return is the main cause of the pulmonary congestion, at the same time there is a reduced cardiac output. So obviously the subjects who are having the syndrome cardiac failure, in their case there is a reduced cardiac output. Okay, the ventricular muscles unable to contract properly. So due to the inability of the proper contractions of the left ventricles, there will be less cardiac output, less stroke volume, right? So here the most important factors that is related with the breathlessness is reduced cardiac output. Along with this, you can see nocturnal dyspnea, another important factors. So in this particular case, it is also a classical sign of the worsening of heart failure. All these things are given in the case. Right? So now, before the diagnosis, obviously you must ask about these type of factors, so that it will be more easier in the diagnosis. It will be more easier to correlate with the reply that is given by particular patients with the physiological mechanism. Now, other than this, a volume overload is another important justification for the diagnosis of the disease. So you can see here, ankle edema. This is also given in the case. So here you can see. So during the bilateral ankle edema, there is a retention of fluid, right? There is a retention of fluid, and this fluid retentions are the most important features of right-sided heart failure. So in the case, these information was given. Say, general physical examinations reveals edema in her ankle, right? So if there is an edema in the ankle, so as I mentioned, it is the most important features, so common features of right-sided heart failure, right? Now then, jugular venous distension. So how it is involved with the volume overload, or how it is involved with the diagnosis. So this jugular venous distensions, it is easily identifiable, right? This vein is basically present in the neck region. So in this particular case, there is an enlargement of this vein, right? So it reflects increased arterial pressures. So these enlargements of the veins or arteries ultimately leads to the changes in the pressures in the arteries, which is a sign of right heart strain. So this right heart strain is mainly main cause of right-sided heart failure. Other than this, the information is also given about that the annulus levers. So which is likely due to the hepatic venous congestions. So these are some classical symptoms that are useful, or we can say the most useful symptoms based on which we can diagnose the subjects, and we also can explain how these factors physiologically involved with the development of disease. Now you can see the physical examination findings. What was given? The first one you can see pulmonary edema from left-sided heart failure, where fluid leaks into the alveoli due to increased pulmonary capillary pressure. So here, as I mentioned, the subjects are having edema. So this edema ultimately leads to the development of left-sided heart failure, and where fluid leaks into the alveoli, and it is due to the increased pulmonary capillary pressures. So the information regarding the heart rate also given. It is not normal, more than normal. So this high rate of heart rate is mainly due to the hearts are trying to cope up with the particular conditions by more and more contractions, right? So here you can see this is a compensatory mechanisms. So due to the compensatory mechanisms, there is a changes in the heart rate, right? The heart compensates for the reduced stroke volumes by increasing heart rate. Now another important things that is given is blood pressures. So this is reduced blood pressures. So obviously, if there is a less amount of stroke volumes, or if there is a less cardiac output, obviously in the blood vessels there will be less blood flow. So the pressures exertions will be less in the blood vessels. So here this is again, it suggests reduced cardiac output and possible decompensated heart failure. Now along with this, some past medical history also given. So how this past medical history involves with the diagnosis process? See, long-standing hypertensions and myocardial infarctions, both are given in the information given in the case. So how this long-standing hypertensions and previous myocardial infarctions are related with the disease developments? Yes, major risk factors for heart failure due to chronic afterload. It means the resistance that increase leading to left ventricular hypertrophy and diastolic dysfunctions. Now, as I mentioned, the heart failure is not a single disease. It is basically a syndrome, which is a combinations of lots of physiological abnormality of our cardiac systems. So here, in patients, there was a previous cardiac abnormality, that is myocardial infarctions. It indicates prior myocardial damage, so that reducing cardiac contractility and increasing the risk of heart failures. So these are some justifications how these factors help us in the diagnosis of the subject. Now, what is the physiological basis of symptoms? Yes, if you see the these conditions, what is the main causes of these conditions, or how these conditions alters the physiological process? Shortness of breath, the main causes of the development of the left ventricular heart failures. So left ventricular failure leads to increased pulmonary venous pressures as blood backs up into the lungs. This causes pulmonary congestions, which is an accumulation of fluid into the lung alveoli, as well as there is an interstitial edema and reducing lung compliance, along with the impaired gas exchange. So, due to the impaired gas exchange, there is a shortness of breath, and this shortness of breath are the most important features or clinical features for this particular disease. Then nocturnal dyspnea. Here you can see a venous returns, increased venous returns to the heart. So this is most important things that is related to the heart failures. Here's overwhelming the filling left ventricles. So as I mentioned in the definitions, two things are involved in the heart failures. One is the abnormality in filling, and another one is ejection, right? So this particular case is mainly involved with the abnormality in filling process, right? That further rising the pulmonary capillary pressures. It also involves the fluid leaks into the alveoli, that worsening the dyspnea. And this dyspnea is an important clinical signs of the heart failures. Now the last case, you can see fluid accumulations in the alveoli from elevated pulmonary capillary pressures creates fine and crackle sounds during inspirations. This is another important physiological features based on which we can diagnose the subjects. Now see, here's how this tachycardia is related with this. As I mentioned, there is a altered heart rates which actually occurs into the subjects who are having this particular syndromes. Why or how it is related with the conditions? Sympathetic nervous system activations compensates for reduced cardiac outputs and trying to maintain perfusions to vital organs. So obviously, so as you know, we need sufficient supply of oxygens. So to supply sufficient amount of oxygens, it needs the availability of sufficient blood flow. So means it needs to maintain proper perfusions. So here, to maintain the proper perfusions, we need to change the heart rates. So here the things happens. So it is a compensatory mechanisms. This compensates for reduced cardiac outputs, that is trying to maintain the perfusions to vital organs. Now, see the hypertensions. The severe left ventricular dysfunctions reduces stroke volume, so leading to low cardiac output and ultimately leads to the development of hypertensions. Now, so up to this, we could say there are numbers of physical factors as well as numbers of physiological factors, and all those factors are directly involved with the developments of these syndromes. Now we have to remember the most important facts or most important factors, either it is physical factors or physiological factors, based on which we can diagnose. Now, what are the different types? As I already mentioned about the types of heart failures, mainly heart failures are classified into different way. Here I have mentioned two things. One is left-sided heart failures, another is right-sided heart failures. So what are the most important features of both the left-sided heart failures and right-sided heart failures? You can see in case of left-sided heart failures, there is a reduced ejection fraction, and it is due to weakened heart muscle, right? So in the case it was given the persons having past medical history of myocardial infarction. So in myocardial infarctions there is a damage in the myocardial muscles or cardiac muscles. So how these conditions is related with this? You can say in this case there is a reduced ejection fractions and it is due to weakened heart muscles. In case of diastolic heart failures, you can say there is a preserved ejection fractions but impaired ventricular relaxations. So you can see there is a impaired ventricular relaxations. So in the first case it is related to the contractions, but here it is related to the relaxations. See, and impaired ventricular relaxations which affects the feelings of the ventricles, right? Now you can see right-sided heart failures, and it is typically secondary to left-sided heart failures, which is also known as the pulmonary hypertension. And you can see in this particular case the most important comorbidities that are related with the development of this disease is the chronic lung disease, pulmonary embolisms, and biventricular so-called congestive heart failures. So these are some basic informations that are important, that is used to explain about the most important type of heart failure, so-called left-sided heart failures and right-sided heart failures. So I hope up to this is clear. Now we have some possible treatment strategies. So what are the possible treatment strategies and what are the most common causes? You can see these are the most common causes of the heart failures. As I mentioned, is the syndromes. The most common causes are ischemic heart disease, chronic hypertension, cardiomyopathies, then valvular heart disease, arrhythmias, infections, toxins, congenital heart defects, and pulmonary hypertension. So all these individual pathological conditions act as an influencing factors for the developments of this syndrome. Now, what is the possible strategies for the treatment? You can see the physiological basis of heart failure treatments. You can see first one is renin, angiotensin, aldosterone systems inhibitions. Again, like previous one, there are some inhibitors which inhibits the actions of angiotensin converting enzymes. So it blocks the renin, angiotensin, aldosterone systems by inhibiting the conversions of angiotensin 1 to angiotensin 2. So what is the effects of these inhibitors? So the effect is it reduces the vasoconstrictions, means it improves the blood vessels so that blood flow can occur, and it also changes the retentions of sodiums and waters, as well as it improves the ventricular, it changes the ventricular remodeling patterns, right? It lowers the preloads and afterloads that ultimately helps to improve the cardiac output, which is very, very important for the subjects who are having these particular symptoms. Now, what are the clinical impacts of these RAS inhibitions? It lowers the blood pressures, it reduces the heart strains, as well as it slows the heart failure progressions. So this is one mechanism by which we can treat the subject. Another one is the beta blockers. So what is the most important mechanism by which beta blockers can act? It inhibits the beta adrenergic receptors, and the inhibitions of these beta adrenergic receptors ultimately reduces the sympathetic overactivity, right? So what is the most important effects of the changes in the sympathetic overactivity? It slows the heart rate, right? Decrease the myocardial oxygen demand, and also it reduces the cardiac remodeling, right? And what is the clinical impacts of these beta blockers? It improves the survival rate and ultimately reduces the rate of hospitalizations and improves the heart functions over times. So these are some basic discussions that are related with the case 2. So here in these lectures I have basically discussed two things. The first case was related to the diagnosis of hypertension. In the second case I have discussed about the most important features by which you can diagnose the subjects, that is the diagnosis of the patients who are having heart failure. Thank you.